Hi, my name is Jason Spangler, and I'm the CEO of the Innovation and Value Initiative, a nonprofit research organization committed to advancing the science, practice, and use of health technology assessment, or HTA, in healthcare. Major depressive disorder, or MDD, is a major public health problem with significant economic costs. In addition to the devastating health effects, untreated depression can lead to lost productivity, absenteeism, and increased healthcare costs. The annual cost of depression in the United States is estimated to be $210 billion. The IVI-MDD value model is a health economic model that can help payers, employers, researchers, and patients make more informed decisions about depression treatment.
I'm Mike Thompson, President and CEO of the National Alliance of Healthcare Purchaser Coalitions. We represent an umbrella of over 40 employer coalitions across the country, collectively representing about and providing coverage to over 45 million Americans. When we look forward, what's the potential to have a common understanding of this broader economic model? It's really for us to think about, how do we treat depression? Rather than a focus that is geared towards mitigating the short-term costs of treatment, but rather thinking about, how do we actually get to the end goal faster of getting people well and back to their best?
Hi, my name is Teresa Nguyen, and I am the Chief Research Officer at Mental Health America. We are one of the oldest and most awesome mental health advocacy organizations in the country. And I'm also a person who lives with depression and complex PTSD. So I partnered with IVI on the development of their MDD model because I really do believe that mental health products and solutions that are developed with people who live with mental health challenges are better able to capture the real need and impact on our community. A highlight of the journey in developing the depression model was learning about how these models can inform policy and program decisions. And now that the model is launched, I hope it empowers people and families who struggle with mental health conditions to understand how the cost of care and treatment protocols impact what kinds of treatments we have access to. And in doing so, we can continue to advocate for the kinds of treatments that are needed to support those treatments that allow us to live healthier lives.
My name is Mike Grabner, and I'm a principal scientist at Carolyn Research, formerly known as HealthCore. From a payer perspective, I'm most excited about using IVI's model to get insights into the treatment pathways and associated benefit designs that can optimize care for our members. There are many treatment options, both in terms of medications and psychotherapy, with varying side effects, and patients likely differ in what works best for them. And this model will allow us to compare different approaches to treatment sequencing. We're also looking forward to exploring how members who have other chronic physical or psychological conditions could be best cared for compared to those without, and what impact different delivery options such as telehealth have. There are a lot of open questions to explore, and we're grateful to the IVI team for collaborating with us.
Hello, my name is Bruni Canoe, and I am a Togolese American raised in New Jersey. Right now, I serve as a researcher, founder, mental health activist, and medical student. So there are many factors as to why I didn't actually get help with my mental health until college. One of which being that I grew up in a culture that really neglects or doesn't think that mental health disorders are something that is curable, and there's just so much stigma around it. I also grew up in a low income household, and so there weren't a lot of resources that I could use if I even wanted to get help, other than, I guess, going to my school counselor. And the last part, which is one of the more important parts, was the fact that for a while, for no real reason for my own, I was undocumented for a long time. And so I didn't get access to even healthcare or formal healthcare, right, until later in life. And so all of those factors kind of came together and was the reason why I couldn't get help until later. Lucky for me, when I got to college, I was referred to a program that basically scheduled a meeting with me and told me about all these resources that could help me with my mental health. And they really connected me to a team of providers to help me along my journey.
My name is Olivia Labarsky. I am a former NCAA Division I gymnast and a current member of Mental Health America's board of directors. I personally struggled with depression for several years, most prominently during my freshman year of college, and I believe that my depression stemmed from my stubborn perfectionism. I was pushed by my college teammates to seek help. But instead of finding a clear pathway to wellness, I found that obstacles presented at every stage. It was challenging to navigate finding a treatment provider that accepted my insurance and could accommodate the demands of my rigid practice and class schedule, but also one that wasn't too far away from campus. Ultimately, finding a treatment provider that I felt that I could truly connect with came second to simply finding a treatment provider that was convenient. As an athlete, I perceived a specific glaring disconnect between the support and treatment that I was able to access for my depression versus for my physical injuries. We each have our own journey. Researchers and decision makers need to account for these differences to validate the full impact of major depressive disorder on all of our lives. Thank you.
Hello, I'm Reverend Pamela Yerby Hammack, the executive pastor of the City of Abraham Church and Ministries. MDD impacted all of my life, academically, economically, personally. My relationships were impacted, my relationship with my husband and my siblings, my parents, my daughter. I also, at that time, found it hard to work because I couldn't concentrate. And so I had to stop working for at least 2 months. At that time, I was also in seminary, working on my Master of Divinity degree, but I had to withdraw from my studies because of the constant confusion in my mind. I became very fearful, very sad, codependent. I was in such a dark place. But over a period of time, after receiving the help that I needed, the treatment process allowed me to see the light once again. I also learned that recovery is not a sprint, it's a marathon, but recovery is possible.